Hello everyone, myself Parmar Maulik, 4th year B physiotherapy student at Marwadi University. Today we're gonna learn about the classification of the splint as well as their general function of the splint. First we see about the general function of the splint and then we are going towards the classification of the splint. The general function of the splint we will understand like in the funny way. If I got injured, then if what occur? Then body says I have a weak structure. Splint says, don't worry buddy, I will be help you. I will be strengthen your muscle. I will be immobilize your part. Body says I am having the more mobility in my joint because of the injured structure. What happened? Splint said that don't worry, I will be help you. I will be immobilize you. And what occur? Body says that if I don't have a movement, if I am in the more movement, if I were injured, I will go into the wrong pathway and create a more deformity. Then Splint said that don't worry, I will be preventing as well as the correcting your deformity. Okay, don't worry. And body says that I am having the more pain in my area that I injured. Don't worry, I will be relieving pain by immobilize your part as well as the resting the structure. It will heal the process. It's give you a quick relief to your pain. Body says that what about the strengthening purpose? If I giving you a proper position, that is automatically strengthen your muscle only. The splint is having the many of the function. We already said that the splint is support the weak structure, immobilization, prevent and correction of the deformity, pain relief, maintaining the position of the joint and the strengthening of the muscle. Now we see the classification of the splint. Classification of splint. First of all, what is the splint? Splint is the one of the external appliance that control, assist as well as immobilize the part of the body. So classification of the splint based on their function, there are mainly four classification: static, serial static, static progressive and dynamic. Static, what do you mean by static? Static means it's not allowing any motion in any of the plane, right? Static planes we mainly apply to the patient, those who are having the more chances of the deformity, like in the plantar flexion deformity, means equinus deformity, right? Then serial static plane is the one of the splint that giving a passive and a stretch to the soft tissue that allow the new passive range of motion, like in the CTAV patient. Those who are having suffering from the CTAV, at that time we are giving the serial static splint. So it can be prevent soft tissue adhesion as well as the deformity. Then static progressive. Static progressive is the one of the splint that allows the soft tissue that therapist apply a static progressive splint at the end of the range of motion that stretch the tissue level and also increase the passive range of motion. Then the dynamic splint. Dynamic itself suggests it allow some degree of the movement at the joint. Means we are having the classification of the splint based on the region. Means first we see in the ankle classification we are having a posterior hip splint that's mainly help for the foot drop. Then stirrup splint is mainly is for the ankle as well as the foot immobilization. And lower leg short leg cast immobilization of the ankle as well as the foot that cannot give any kind of the range of motion to the lower leg. Then knee, posterior knee splint. It's mainly used in the soft tissue injury around the knee, ligament tear, muscle rupture around the knee. Then hip region, we are having the von Rosen. The von Rosen is mainly used for the congenital dislocation of the hip. Then the Thomas, it's like the traction splint. It's mainly used for the injury around the thigh area as well as the hip area. It's immobilized the whole things. Then Bowler Brown splint. Bowler Brown splint is mainly used for the anywhere the fracture occur in the femur area. Now we see upper extremity splint. In the ulnar side, we are having the ulnar gutter splint that is mainly held for the fourth and fifth metacarpal as well as the phalanges dislocation. Radial side, we are having the radial gutter splint. It's also same function, first and second metacarpal as well as the phalanges dislocation. Thumb spike are mainly used for the thumb injury. Then finger, it's mainly in the finger we are having the mallet finger splint. That's mainly help in the mallet finger, that will be a extensor tendon injury of the extensor tendon. Then wrist, in the wrist we are having the volar and dorsal forearm splint that's help into the CTS as well as the wrist immobilization as well as the wrist injury or the fracture of the radius as well as the ulna. Then we are having in the wrist we are also having the cock-up splint that's mainly used for the CTS patient. Then also we are having the knuckle bunder splint that's mainly used for the ulnar nerve injury. Then in the forearm we are having the single sugar tongue. Elbow we are having the long arm posterior as well as the double sugar tongue. Then mainly used for the dislocation of the elbow, fracture around the elbow like the distal end of the humerus fracture, condyle fracture as well as the proximal end of the radius as well as the ulnar fracture. Then we are having the shoulder, we are having the aeroplane splint that's mainly used for the brachial plexus injury as well as the Burns cases.